Welcome back to ACL Academy. Today we're going to touch on when we first get injured. What should we do? It can be a very overwhelming process, especially when we first get that confirmation that it is a full ACL tear. A lot of thoughts start to creep into our head about doubt, about how long the process can take, about if we will ever return to the athlete that we once were. Will we be able to play the same sports and activities? So a lot of these thoughts start to kind of really sink in, and then most of us feel very, very lost. So in today's video, what I'm going to talk about, some crucial steps, what you should start doing right away. This way you can get up a plan in place and start moving forward in the right direction. So you just got out of the orthopedic office, right? You had your MRI done. Physical exam was done by the orthopedic. They moved your knee around and basically they sat you down and they said, hey, we determined that you have a full ACL tear, full ACL injury. Now, in those cases, most good doctors will go over some options for you. Basically, they will tell you that this is a very important ligament, right? The ACL is one of the four ligaments, the four main ligaments in the knee. And this is super crucial for giving some stability and support, especially as we are participating in sports that require maybe some jumping, some twisting, some turning, things like soccer, volleyball, skiing, basketball, where we are required to move in different directions quite quickly. So that ligament provides a very stable structure for the knee so it doesn't slip or shift. And that's why in the majority of cases, what a surgeon will tell you that this needs to be fixed. This ligament needs to be fixed in order for you to return back to sports. Now, I do believe that that's not always 100% the case. However, that video is for a different time, and we can chat about options as far as what to do after an injury, whether to have surgery or not. In this video particularly, though, I'm going to talk about some important steps on no matter what, whether you choose to go for surgery to get it reconstructed, or if you choose a more conservative route, meaning you just do rehab without getting surgery in the first place. So again, we're back in the doctor's office. The doctor gives you confirmation that it is an ACL tear. It says to you, can schedule surgery. And if you do schedule surgery, what I would request is you schedule that surgery to be at least 8 weeks out. And the reason that we do that and say that is because we want to prepare the knee for this surgical process. And what does that mean? Well, we know that the better the knee looks going into surgery, the better the outcomes, the more smoother the recovery process. So we will educate that after an injury like this, it's important to start rehab right away. So it's important that you find an ACL rehab specialist that particularly works with this type of injury. And there are certain prerequisites that we want to go over, okay? When we first get injured, there's going to be some pain and there's going to be a lot of swelling in the knee, right? Because there's an injury to the joint, so you're going to have swelling. The body is trying to heal whatever's going on, so we're sending more blood and more nutrients to that joint. And what happens is sometimes that knee will swell up. So the first phases of rehab, or the first things that we should start doing, is pain and swelling management. Okay, so what does that mean? Well, we should get off of our feet. The more that we're on our feet, the more that we're putting weight through it and our body through it, we're stressing the knee joint. So it's important to get off your feet. It's important to get your leg elevated, and it's also important to get it compressed. So elevated, meaning getting off our feet, getting the leg elevated above the heart, as well as compression, meaning either ACE bandage or wrap around the knee, or even like a neoprene sleeve to give some joint compression. This will help with some of that swelling control. Secondly, it's also important for us to gain range of motion. So we're looking for gains in bending and straightening in the knee. When the knee, again, occurs an injury like this, because of pain, because of swelling, what our body does is seize up, lock up, and not want the knee to move. If we continue to keep the knee in a still position, well, it's going to get stiffer and stiffer and stiffer. So it's our job to combat that. So first steps, pain and swelling control. Second steps is to get the knee moving again. So we want to start bending and straightening, and we want to make sure that we can achieve full extension, which is the straightening of the knee, as well as full flexion, which is the bending of the knee. So that's the second step. And the third step, after an injury like this, our quad muscle, that front thigh muscle, sits in the front, goes from the hip all the way to below the knee. That's the most crucial, important muscle. And after an injury like this to the knee, that quad muscle will go on vacation. It'll shut down. It's the body's protective response. So it's our job to wake it back up and to get it going. So we want to start exercising that quad muscle, get it to start contracting again and get it strong again. And this will also help our knee function and our movement, as well as carry over to walking and standing and things like that. So just to kind of recap, okay, we went to the doctor's office, we got the diagnosis. First thing that you want to do is find an ACL specialist, a rehab person, to help start guiding your process, and you can start rehab right away, the next day, okay? The important factors that we're working on: one, pain and swelling control. Okay, after an injury like this, we want to take care of that swelling. The faster we take care of that swelling, it's going to carry over to our second phase, or second most important, is getting that straightening back and getting our bending back. So getting the knee moving again, bending and straightening. And then third and finally is getting that quad strength back. As I said, after an injury like this, the quad muscle will go on vacation. It will shut down as a protective response. We want to wake it back up. So those are the main things that we want to focus on after an injury, because if you are choosing to have surgery, as I said, the better the knee looks going into the surgery, the better, smoother the rehab and the outcome would be after. So those prerequisites are getting swelling down, getting full motion, and getting quad strength back as much as possible. If you can get those things and obtain them, again, your rehab process will be that much better after you choose to have surgery. And then if you're in the boat where if you're trying to rehab, these steps are still very, very similar. So I know it can be an overwhelming process. I know it can be frustrating. You could be nervous about what the next steps are, but it's super important. If you do get an ACL injury and it's confirmed by the doctor, you need to start rehab right away. The faster that you can start rehab, the easier the process will be, whether you choose to have surgery or whether you choose to continue conservative care. So I hope you found that video helpful. If you did, please please subscribe to our channel. You can comment below with any questions, and I look forward to seeing you guys next time.